Guys, in this video, we want to look at iridectomy, something they are doing to the iris. So, iridectomy. So, where is the iris, guys? Here you can see the iris, and they made some hole here. Iridectomy. So, what is iridectomy? It is an abscission. It is an abscission of part of the iris. So, there are many types. There are 3 types: peripheral, keyhole, and broad or sector iridectomy. That will be, sector will be more like a complete radial section, right, of the iris. Peripheral will be in the periphery, right, in the periphery it will be in somewhere here. What do you think keyhole is? Guys, why will you do this iridectomy? Indications. So we are doing this. Treatment of all stages of primary angle closure glaucoma. All stages of primary angle closure glaucoma. If there's angle closure glaucoma, what will happen? Basically, the iris, the pupil block will be there. So the aqueous cannot get out of the posterior chamber to anterior chamber. Iris bombay will occur, where the iris will bulge out like this, and then because of this bulging, angle will get closed. So what they will do now, they will come and do an iridectomy here. So all the pressure will get released and iris will come back to shape, angle will open up and no glaucoma. So basically, treatment for all stages of primary angle closure glaucoma, prophylaxis and fellow eye. So if they are going to suspect that this guy is an angle closure suspect, so they can do a prophylactically an iridectomy in the fellow eye, in the other eye. If there's prolapsed iris, they are doing iridectomy. Okay. For optical purposes, optical iridectomy means what? What is optical iridectomy? Important word, they'll ask you in exam. Basically, in cornea, if there is central or macular or leukomatous corneal opacity, then they will do an optical iridectomy. Okay. So the vision improves with pupillary dilatation. Let's look at these. It may be performed in cases of central, macular or leukomatous corneal opacities. Go here, central, macular or leukomatous, that is nebular. Nebular, macular or leukomatous, whenever there is, see right in the center there's some opacity, right? So in these cases they are doing an optical iridectomy, right? So with pupillary dilatation, at least they'll be able to see. Optical iridectomy is a surgical removal part of the iris to enlarge the existing pupil. So they are planning to enlarge the existing pupil. That's what is key here. Okay. Artificial pupil they are forming when the natural pupil is ineffective. So you got what optical iridectomy is, right? This they will ask in the exam, specifically what optical iridectomy is, they will ask. Okay. As a part of glaucoma operation, so when they are doing all this, what glaucoma operation means, what? Trabeculoplasty, trabeculectomy, or glaucoma drainage device. Are they talking about that as a part of glaucoma operation? For removal of foreign body, cyst or tumor of iris. That's it. This is peripheral iridectomy indications, is it? Oh, these two are peripheral iridectomy indications. These are overall. You can remove foreign body also, is it? And tumor. Okay, tumor of the iris if you want to remove. Okay. So, removal of foreign body. Okay. So, guys, we're done with the indications of iridectomy. Technique. 4 mm limbal or preferable corneal incision is made with the help of razor blade fragment. Then iris prolapsed. The posterior lip of the wound is depressed so that the iris prolapses. If the iris does not prolapse, it is grasped at the periphery with iris forceps. Do you know how iris forceps looks? Look at these delicate forceps. They have some teeth also. Then iridectomy. Now they are removing small full thickness piece of iris is excised by a De Wecker's scissors. They have a De Wecker's scissors or Vanna scissors at 12 o'clock position. Why? Because here in the upper eyelid will cover this surgical scar, right? Because upper eyelid covers this part, right? So nobody will be able to see that you have a iridectomy. So at 12 o'clock position, they are doing a small full thickness piece of iris excised. Vanna scissors. Do you know how Vanna scissors looks? See here, Vanna scissors. Then what are they doing here? Reposition of iris. Iris is reposited back into the anterior chamber by stroking the lips of the wound or with iris repositors. This is the iris repositor. With this, they are repositing the iris. Okay. Then wound closure you will do, guys, with 1 or 2 10-0 nylon sutures with buried knots. Then subconjunctival injection they are giving of steroid, dexamethasone and gentamicin, which is antibiotic. Strange, right? And then they are giving some eye patch. Look at here the suture. They said the buried knots, nylon suture. Look at that. It looks like that. Look at this photo here. A, what is A? A is anterior limbal incision to open the anterior chamber. Then B is the prolapse of the iris. For a prolapse of peripheral iris by pressure at the posterior lip of the incision. Excision, C. C is the excision of the prolapsed knuckle of the iris by D. Wecker's scissors and then suturing the wound. Okay, nylon suture they will use. See, a person who has a hole in the iris, that can be a congenital coloboma or it can be a surgical coloboma. Okay, iridectomy it can be. See, when they are doing cataract extraction, that time they are doing this iridectomy to prevent post-operative pupil block glaucoma. This is along with the capsule, they are removing the lens, but this is an obsolete technique. Okay. And if I'm not wrong, they said in AFAK also they do this. Okay, so now where are we? Surgical technique we finished. Then what did we see? How do you treat a case of acute primary angle closure? We told you there are many things. Of them, some things are peripheral iridectomy and even in the fellow eye, right? Prophylactically. So they have done something here like that, right? So basically now here they are talking about yet another terminology called as laser iridotomy. Now what is iridotomy? Iridotomy is just an incision they are making, okay, which can be surgical or laser, via laser. And they are telling always you prefer a iridotomy over a surgical iridectomy. Laser iridotomy should be preferred over surgical iridectomy. What is iridotomy? It is an incision, that's it. It can be performed surgically or with laser. Okay. What are the indications for iridotomy? Same thing, narrow angle glaucoma, 4-dot iridotomy for iris bombay. So what is iris bombay now? So because of this pupil block, the iris is bulging out. This is iris bombay. They have a 4-dot iridotomy. What is that? Okay guys, so anyways, iridotomy is an incision. Okay. It is better than iridectomy. They are telling you always should prefer an iridotomy. Okay. So in this video, we looked at what iridectomy is. Basically, it's an abscission of a part of the iris. You have peripheral keyhole, broad or sector iridectomy. And why will you do this in iridectomy? To treat primary angle closure glaucoma. And you will do it prophylactically for the other eye. If there is a prolapsed iris, or if there is for optical purposes, optical iridectomy, right? That is, what did you see here? Basically, in corneal opacity, you will do this, like the nebular macular leukomatous. So they will do this so that they can improve the vision by pupil dilation. Then, as a part of glaucoma operation, as a part of cataract operation, we saw actually to remove foreign body tumors, cysts, etc. AFAK also. So iridotomy, basically it should be preferred over iridectomy. However, if you are doing iridectomy, you will do a limbal incision, iris prolapse. This is a 4 millimeter limbal or corneal incision, and this is an iris prolapse. Then you are going to use the Savannah scissors or something, and 12 o'clock position you will remove the full thickness piece of iris. You will excise. Okay. Then you will put a nylon 10-0 suture with buried knots. Okay, then you will give subconjunctival dexamethasone, gentamicin, and then you will patch the eye. Okay, so when you see somebody with a hole in the iris, it can either be congenital coloboma or an iridectomy, which is nothing but a surgical coloboma. In corneal opacity, we told you they'll do something called as an optical iridectomy. So in the exam, they will ask you what is optical iridectomy. You will say you will enlarge the existing pupil, mainly in corneal opacity, so that you can improve the vision by pupillary dilatation. What type of corneal opacities? Nebular, macular, leukomatous. Then we saw this iris forceps. We saw the Van Ness scissors. Then as a part of cataract extraction intracapsular, that's obsolete now. That's it. So you will do a peripheral iridectomy in the eye which has glaucoma and the other eye prophylactically to treat angle closure. Okay, acute primary angle closure. So that's it in iridectomy. Hope you have learnt what iridectomy is. Bye bye.